Hello again, it's Harry here, your geriatric nurse from Toronto, Canada. I'm back for more information dissemination for the promotion of the care for the older adults. Today, I'd like to discuss the care for older adult in hospital who may be experiencing delirium. This probably is more targeted towards professional caregivers in hospital, but hopefully the family members and caretakers at home will benefit as well. So when your loved ones are in hospital, you'll be able to advocate for them accordingly. And so I'll start with a diagram. Now, don't get intimidated. It's basically I have a wellness continuum on one side of this diagram. Above is health, and below is death. When an older adult comes in hospital, there's usually a primary diagnosis that we treat them for. Okay? And usually, it's if not medication, then we would start an operation, something like that. So to treat the primary diagnosis. All of these things could cause an acute confusion to the older adult. And when there's an acute confusion, there's what we call the CAM assessment, confusion assessment method. And we look at four things. We look at a new onset or fluctuating cognition, and inattention. So those two things, plus and or two other things. The third thing is disorganized thinking. And the fourth thing is level of consciousness. So we have two types of delirium. When they are CAM positive, they will be positive for delirium. And there are two types of delirium: hyperactive and hypoactive delirium. So for hyperactive, that's when you'll see so family members will say they're not how they are usually. For some people, they are more confused and hyperactive, and for some people, they're just sleeping and just hypoactive. Yeah, when we receive patients like that, again, as I said in the previous video, early detection and early treatment. So the older adults already at a disadvantage when they get sick because the physiological changes in their body, on top of the active disease process that they have, put them at more risk of developing delirium. So your early assessment and early interventions will be very crucial. So again, focusing on treating the primary diagnosis because that's your most likely source of the confusion. But also being aware that your interventions to treat this can also put a delirium burden. And it's important to always maximize your non-pharmacological interventions, whether it be hypoactive or active delirium. So I'll start with the therapeutic use of self. I always say giving medications, providing care, any patient interaction can be more than just that. When you are using yourself therapeutically, you listen to them actively, you try to explore how they're feeling, you try to acknowledge what they're feeling. And usually our first go-to is to reorient the patient. But if you find that that's upsetting them and they're really adamant in what they're believing, and for example, there's a delusion, then you pivot to using your reassurance and validation. And validation is like living in their reality. So instead of correcting them and reorienting them, you just you do not correct them. Okay, and there's a skillful way of doing that, because sometimes you want to be able to live in their reality without compounding their delusion. Yeah, but that's another topic in and of itself. Also, you can use positive regard. So instead of them hearing that your frustration because of their confusion, always leave them with a positive regard. Oh, you're in hospital, I'm your nurse, we care for you. It's better to leave them with those caring, reassuring words, as opposed to them feeling the business of the unit, your business. So do your best effort to do that. Of course, your gentle, persuasive approach should always be there, especially remembering that tasks are just secondary, especially for actively delirious older adults. Do not insist a task. Make sure you stop and reapproach whenever they're ready. And implore help from your colleague whenever it's needed. And also utilize the resources in hospital. So for example, if you have in our hospital, we have the geriatric medical consultation services or a behavior support Ontario. So make sure you maximize those as well. And also, while you're doing these things, make sure that you are also imploring the help of the interprofessional team. Your PTOT, early remobilization of your patient, is very important in their recovery. Spiritual services is also very important if there's something that's helpful for if something important to the older adult. Your activation in the unit can also play a significant role, so that we can promote wellness in whatever level they are. If these non-pharmacological interventions are not effective, there are some other interventions that are available. For example, there can be physical or physical or chemical restraints. And we always want to promote least restraints, but there are times when the confusion is just so severe that you need these interventions. But you have to use it with caution, because again, any interventions can come with possible delirium compoundment. Meaning that, for example, if you use physical restraints, they will be at risk of developing infection, skin breakdown, even worsening of the confusion. So that's why you always have to use caution when using these kind of interventions, and ensuring that you have exhausted all the non-pharmacological interventions before you have come up to that the restraints. Okay? And also, when you start with those, you want to go low and slow, and always aim for timely re-evaluation of that intervention, especially if it's physical restraints, because for that, what it can do to the skin. Equally important is your chemical restraints, because then confused patient may end up at risk of falling even more when you use your chemical restraints. So again, we don't want those interventions, but they're there if needed. And hopefully it's not our first go-to. Make sure you are exhausting the non-pharmacological interventions. And also, I want to highlight, throughout their process, always maintain the non-pharmacological interventions, so that we can always promote their wellness and hopefully prevent death. Thanks so much. I know it's longer than usual, but I hope this has been helpful to you guys. Take care.